I would like to introduce Marice. She's the CEO and founder of ChangeLab Solutions. Has anybody here in the audience used ChangeLab Solutions or frequent its website? Marice, you can't see that, but we have a handful of people who frequent ChangeLab Solutions. For those of us who aren't familiar with this tool, it has tools on law, public policy, and leadership engagement. They design practical solutions to help all communities, especially communities at risk. They work in all 50 states. They work on public policy issues touching on every stage of life. ChangeLab Solutions creates multidisciplinary partnerships to tackle complex social problems, empower people, improve outcomes, and save money. Marice herself, who's joining us today, we are really honored to have her because, as I mentioned, she's the founder and CEO of this incredible resource. She's both an MPH and a JD, and she received both of her degrees from the University of California at Berkeley. Oh, no, I'm sorry. She's a graduate from the University of Notre Dame and then received her MPH and JD from the University of California at Berkeley. And she frequently attends local, national, and I believe in, Marice, correct me if I'm wrong, maybe even international conferences such as this talking on these topics. So I'm going to turn it over to Marice now.
Great, hello everyone, and I know that I'm joining you from afar and don't have FaceTime with you, which I'm sorry about, and I know that you're deep into your discussions, and I'm coming in midstream, so I'm going to try to move through the slides that I have relatively quickly, so that I'm hoping they're pertinent and relevant to exactly where you are in your conversation right now, but I want to leave as much time as possible for engagement with you, and you can bring me into your conversation as you, I'll let you drive the show after a few slides of introduction. And I'm just thrilled to be here. I'm going to talk a little bit about ChangeLab Solutions. Megan asked me to talk about where we're seeing some real success around the country, and I'm just going to zero in on a couple of places. But the work that I'm talking about is happening everywhere throughout the nation. So you all are in good hands and moving right into the norm of where health agencies and their partners are going. So I'm going to talk about success and using public policy as a success for that. I just will move, hoping, let's see, trying to figure out how to work this. I used my clicker. I have my IT guy here helping me. Thank you, Bernard. So I have to give a disclaimer. I'm a lawyer. I'm not your lawyer. I'm going to be talking about legal policies, but not giving legal advice in this slideshow today. A little bit about ChangeLab Solutions. Our mission is to improve the health of communities through better laws and policies. And we do that in any number of different ways, and I'll talk about a lot of them today. Everything that I talk about today, we have free for download models, laws, policies, toolkits. I'll show some of them at the end, but everything I talk about is supported by ChangeLab Solutions. Free for you to use at your will and discretion. One of the things that we always talk about, maybe you've already covered this, and so I'm not going to dwell on it. I'm assuming you've covered this in your discussion today. I call it the health impact pyramid, the freedom pyramid. And really, the point here is that to get the greatest impact on population health, we have to work at the bottom of this pyramid, working on socioeconomic factors like poverty, housing, education, and changing the context to make the individual's default decisions easier. And so the examples of that is smoke-free housing, access to healthy foods, bikeable, walkable communities. And working at this lower part of the pyramid requires a public policy approach. You can't do these kinds of changes through education alone or programming alone. It takes work through policy, and I'll show some how it's being used. The other key point I want to make is when we look, this is from the county health rankings, when we look at where the biggest impact on health, what drives behaviors and the environmental conditions, that's 70, you see other charts that show 80% of what the health determinants are in these categories. 4% of our national budget is focused on prevention. So if health departments think that they're going to solve the chronic disease crises in this country with 4% of the health expenditure budget, they'll fail. There's no way we can take just 4% to address 70 to 80% of the problem. So what we really need to be doing is working in a health and all policies context. Health departments must work within the civic culture, the land use planning agencies, the transportation agencies, the housing agencies, the park and rec department, economic development departments, schools. This is how we're going to have our surround sound and create a culture of health, as Robert Wood Johnson would talk about, and to really make our communities so that the healthy choice is the easy choice, the default choice. And I'm going to talk about a couple of examples of how this is done. And the first is that I want to focus on the city of Philadelphia. The city of Philadelphia has really led the nation for a number of years and has shown some important reductions, and I'm going to focus on obesity in Philadelphia. If you look at this chart, and I want to thank the Philadelphia Health Department, I'm going to show several of their slides, and they shared them willingly, as long as I kept their logo and kept them intact, and I'm glad to do so, because they really tell a compelling story. Overall, 4.8% decrease in obesity in school children, African American boys 8%, and Hispanic girls 7%. Really important. We're seeing a decrease in obesity in children nationwide, but that's being driven by higher income white children, families educated with money. We're not seeing these big reductions in low-income communities of color, and Philadelphia has turned the tide. And the way they've done that is through the use of public policy. So here's a health and all policies concept from Philadelphia. So the health department's got Let's Get Healthy Philadelphia. They're working with environmental and community resources, and you can see the Philadelphia Trails Master Plan. That's their active living, planning and economic development. This is part of where they're bringing in. We'll talk a little bit more about their healthy food financing initiative and working with corner stores, transportation and utilities, pedestrian and bicycle plans, complete streets, public safety. A lot of communities, we don't see it here in Philadelphia, but a lot of communities are working with public safety to get streets and parks as safe places for kids to use for play, recreation. And then the schools, the campaign for healthier schools. So they are clearly embedded in a health and all policies framework. And they are driving their changes through the use of policy and systems change. I want to draw your attention to a number of things here. One is the chart on the right. A whole variety of strategies that can be used. There is not a one-size-fits-all to anything that I am saying today. Every community, every aspect of the community is finding its own way based on its history, on its political will, on the cultural attributions that it is an asset that is weaving into its program. But the bar chart on the right just shows a whole bunch of different strategies that schools are using, some more than others. But there's a mix and match approach, which is really gets the ownership at the local level. And you'll see that Philadelphia has been using policy and systems change for 25 years now. These challenges that we're confronting are not quick turnaround challenges, and you've got to be into it for the long haul. And they started with universal foods in the schools, so getting school foods for all kids, not just low-income kids, to take away the sense of otherness and stigma associated with being on school food programs, all the way up to full-service cafeterias now and new federal school meal standards. They also have worked in policies in both nutrition and physical activity. And look at the chart. So they've used their City of Philadelphia food and beverage contracts using the public fisc procurement. This is something that every city can do, every hospital can do. And in fact, I really want to challenge the institutions that are sitting around your table. I don't know who all is there exactly, but I know you've got major hospital systems there. I know you've got city staff there. To take the major institutions, the anchor institutions in your city, and to say we are going to walk the talk and move into health. We are going to buy healthy foods. Our vending is going to be healthy. Our hospital cafeterias are going to be healthy. Everything will be smoke-free. That you use your institution itself to walk the talk and then bring the other business communities and the other sectors, faith sectors, whomever, in your city with you, but start with yourself. And procurement is a great way to start. And you see at the chart at the bottom of this slide, in Philadelphia, before they moved to healthy vending and healthy contracts, 8% was healthy, and after the conversion, up to 40% of the sales are healthy foods. There's concerns, we're going to lose money. Those are short-term concerns. If you do this well, and there's a whole art to doing this well, you can not lose money over the long term. In fact, in many communities, they're increasing sales. Built environment, planning and zoning, complete streets, comprehensive plans and zoning, health-based recommendations built into the general plans or comprehensive plans. Again, everything I'm talking about, you'll find tools and resources on the ChangeLab Solutions website. And I want to just draw your attention to the graphic in the lower right. Really what this is about is community engagement every step of the way. And the community engagement is essential for sustainability and longevity. Let me tell just a little short story, jump to Louisville, Kentucky for a moment. Louisville, Kentucky had a big problem with obesity. One of the strategies they wanted was to increase the walkability of the city so people would use active transportation more readily. They did walk audits with city community leaders right from the neighborhoods. They wanted all neighborhoods to be walkable, so that's universal access to walkable neighborhoods, and they targeted the low-income communities with the worst and decaying infrastructure to where to start, and they engaged the community in doing walk audits. Fast forward a short period of time, there was a big brouhaha. I'm going back a few years now in Louisville, but the mayor was kicked out along with some other city staff for corruption, and all hell broke loose, which happens every now and again at the city level. Big problems with finances, and the city, new leadership comes in, they start cutting budgets right and left if they had to. What was not cut, it was attempted to cut, but was not cut, is the walking program and improving the streetscape in Louisville, because there was so much community buy-in that the residents would not let that go. They wanted those improvements. That is not where the cuts. They have to make them someplace else. The community engagement is essential both for buy-in for the changes and the sustainability around political will, and making sure because this is a long-term process, that there's some stick-to-itiveness at the local level. Other infrastructure changes of success: 30 miles of new bike lanes, 18 miles of new trails. I'm not going to dwell on this, but just to say that there's demonstrable, measurable metrics you can put to these changes which can build momentum, give you a virtuous feedback loop, and start creating more success. Healthy food availability. Philadelphia is the leader, thanks to the food trust there, one of the most preeminent community-based organizations that's now a national player or key partner of ChangeLab Solutions. And we now have the federal government pushing the Federal Reserve Fresh Food Financing Initiative. And you've got metrics here. 300 corner stores, new items, shelving, refrigeration, certification, sugar-sweetened beverage and tobacco counter marketing. So all sorts of activities can happen in the corner store and getting some financing in there. And you'll see that in the bottom right corner again, 65 minutes of exercise for one soda. got your social messaging and your awareness campaigns dovetailing with your public policy and financing campaigns here. Specific use of legislation, trans fats, menu labeling. Philadelphia was out in front of all of these. Look at sugar-sweetened beverage tax. Introduce. This never passed, and you see in the bottom right, big pushback from the beverage industry against it. It never did pass in Philadelphia, but one of the things that I want to just draw your attention to is media controversy alone can be one of your best friends from a public health perspective. It gets people talking about the issue, and it can lead to dramatic change by itself without actually even passing policy. And you see in Philadelphia that the drinking soda has decreased, 24% reduction in teens. This is huge, not only for teens or teenagers, but also that's the behavior they're going to be bringing into adulthood. And you see that adult soda consumption is higher than teens even after their reduction. And if teens go into adulthood, it's that much lower than what we're seeing in current adults. This has really dramatic impact. And the recent study that just came out yesterday on the importance of sugar in the diet, this is really positive news for Philadelphia. Some quick look at some statistics. Sugars or sodas way down. They're doing okay on fruits and vegetables, but not great. There's still a lot of need for change there. Physical activity, screen time. When I started listening in on the call, I heard you talking about screen time, and look at the great improvement in excess TV screen time, but what's it being replaced with? Computer time. And I have a 19-year-old, so I'm right in the teen years myself, and I know how much time is spent, and that's hard to manage. Real challenge. Modest reduction in no physical activity, modest increase in recommended physical activity. Ways to go yet, but they're on the right trends in Philadelphia. Obesity among public school children, way down. All children, girls and boys both, and I want to draw your attention to some specific metrics. If you look at the chart on the bottom, African American boys, 11.3% reduction. Really terrific. Right above it, Hispanic, 1.7%. Not good enough. And I know that you in Austin are really going to be working, huge Latino Hispanic community in Texas. I'm sure you have maybe somebody even sitting at your table from Salud America at UT San Antonio, a tremendous resource right in your backyard there that really looking at how to work with Hispanic Latino population. It's a great resource for all of you. Girls, not as great, but still important. We see African-American girls, 3.8%. Hispanic, not so great. We've got challenges with Hispanic girls in Philadelphia. I think folks in Texas could teach a thing or two in Philadelphia on how to work with Hispanic Latino community. I want to jump quickly to another case story. Richmond, California is in my backyard, extremely low-income community. Historically, predominantly African-American, people moved to Richmond. Rosie the Riveter Museum is in Richmond. It was the place where the Pacific Fleet was launched during World War II, and African-Americans moved to Richmond for the job during World War II. Very low income in the 80s. Southeast Asian immigrants, Laos, Vietnam, Cambodia, moved into Richmond, and more recently, immigrants from Latin America. So now very racially mixed, very low income. And the city of Richmond has really embraced the health in all policies approach, and they've integrated health policy right into their general plan, which is our comprehensive land use plan, what's called here in California. And I want to draw your attention to the section of the plan on community health and wellness. And look at who's got the lead responsibility. You don't see the health department. There are no city health departments in California. They're all county. There's a county health department. of course, but the city's not looking to the county to do this work. They're looking to the planning and building services. They're looking to the Office of Economic Development, engineering, public works, redevelopment agencies. You'll see in other areas, parks and recreation. I'm just showing this as an example that it's health and all policies, all hands on deck is what it takes if we're going to get beyond that 4% of the budget to go where who's got the expertise, who's got the money, who's got the political wherewithal to pull off the changes needed. I was asked by Megan to briefly talk about outdoor dining. How do you get outdoor dining smoke-free? So I'm going to quickly change the conversation here and just move into that. So here's an example of outdoor dining. You can see that they've got signage and very importantly, this is happening, no smoking in outdoor areas all over the country. Here's from a slide from the Americans for Non-Smokers Health. You'll see lots and lots and lots of communities in California, but look at the top of the page. This is page 1 of 7, and the top of the page is Alabama, and then it jumps to California. So this is not California exclusive, although it's very common here, but happening all over the country where outdoor dining coming into popularity. And this is from the American Lung Association. This is California specific, but you see all the different outdoor areas that smoke-free is happening. It's not just dining, but all sorts of other venues, and you'll just see city by city kind of report card here of what's going on across the state. One of the things that we encourage people to do, ChangeLab Solutions, we kind of like our Pandora radio. You know, if you like this song, you might like these others. Well, if you want to go smoke-free dining, think about your parks, think about your service lines. California beaches are smoke-free because they became a big ashtray in coastal cleanup days. There's more tobacco butts than anything else. So there's lots of options for you to consider in the smoke-free arena, including housing, multi-unit housing. So just briefly, at ChangeLab Solutions, we have all sorts of toolkits. These are designed for health departments and community-based partners, mostly targeting a college-educated. These are not low literacy tools. They're capacity-building tools for local leadership. So lots of toolkits, how-to guides, really zeroing in on the typical policies that need to be passed at a local level to be able to move the needle on obesity or any sort of chronic disease. We have dozens and dozens and dozens of model ordinances. You see here healthy checkout aisles in grocery stores, produce carts, mobile carts that go around neighborhoods. I put these up just as examples. This is pretty fine-tuning the issues, but it gives you big to small. We're trying to cover the universe and the strategies that communities are using. Lots of easy-to-read fact sheets on all sorts of issues, 2-4 pages for a quick overview. And increasingly, we're using infographics to show what's possible and get a lot of information on one page. This is how people are learning more these days and reading even our beautiful toolkits. So the infographic model, and this can be community or learner-led learning, so that many of our infographics are hyperlinked so you can connect to more in-depth tools and resources that you want to see right off the infographic. So I know that was a very speed dating overview of the use of public policy, some success stories, what they look like on the ground in major cities in this country. There's a lot more going on, and a brief introduction to our tools and resources. So let me stop there, and I'd love to engage with you. I hope this was value added to where you are in your conversation. And if there's questions for me, I'm glad to jump in, but I'm also glad to just listen in as you integrate this input into wherever you are in your conversation right now. So I will pause and turn the conversation back to Megan.
Great, thank you, Marice. I could have sworn you were in the room the entire time today, because I think you just wrapped this training up in like a nice little pretty bow. I'm going to pass the microphone around for questions and comments from the audience, but first I just want to thank you. A couple themes that I want to re-emphasize that Marice just talked about is, number one, the importance of introducing ordinances and that their success even if those ordinances aren't passed. Number two, how important community engagement is in her example of the the Louisville Streets policy. And number three, I think that she did a great job of talking about the significant disparities in obesity among our African American and Latino populations. And Marice has the first really good data I've seen of successes. So I'll quit talking and I'll pass the microphone around the room. Who has a question or comment for Marice? I'm going to start with Mary Dodd. She's from our Community Action Network.
Hi. Marice had mentioned that health policy is not only implemented by health departments, but also many other city departments. And that was something that I got from Brooks's talk too. Our panel this morning talked about being aware of who our adversaries are, or the people who are going to oppose what we're working on. I think we might also think of unintended partners. There may be other departments or advocacy groups that would be interested in supporting the policy for totally unrelated reasons. For example, if we're supporting having more water dispensers in the schools, that would be supported by environmental groups or climate change groups, and supporting local food policy or local food production and food produce would be supported by a whole range of partners in the community who we might not suspect. So I think it's important to think about who some of the other unintended friends might be in these policies. So it's really a comment for them.
Okay. Yeah. Have a question there? Can you introduce yourself so she knows?
My name is Chelsea Brass, and I work for the Latino Healthcare Forum and Center for Healthy Communities. I wanted to also add to this discussion that some of the stakeholders in this room were involved in a Texas Health and Policies work group, and so the Sustainable Food Center and the Community Advancement Network and a couple of people, I might be leaving someone out right now, but there was a few of us a couple of years ago that worked with some really great stakeholders on putting together a resolution. So there is that out there with some people in this room who worked on that. So that's great, and that's some progress that's already been made. I guess I would like to ask Marice what she sees as what's happening nationally, because that will affect some of the political momentum, and as people work on local policy issues, might be helpful to have somebody who's more national, like Marice, speak on trends that are happening in the next year or two.
There's a lot of echoing, and I'm not sure I heard the question exactly, but is it to what's happening on the national level over the next couple of years that might be affecting
That's correct.
this movement? Is that
That's
what you're
correct.
asking?
Yes.
Well, at the federal level, a couple things are happening. School nutrition standards. The evidence is pretty clear that school foods are driving some of the national reduction in childhood obesity, at least the leveling off. Getting healthy foods in schools matters. It really matters. And all this pushback that there's, waste, food waste, and all of this is not what's happening across the country. It's making a lot of headlines, but there's a lot of evidence to show that the healthy, tasty food can be served. Those two things can go together. That kids are adopting and eating food, and it's driving the obesity, the leveling off and reduction of obesity. So school foods is really important, and that's going to have that's very political at the federal level, and a lot of lobbying going on, pushing back against it. Transportation reauthorization has been delayed, and maybe with this budget deal that Congress is putting together, there'll be some more money on the table for transportation. The way the transportation dollars work from the federal government is they're sent to the states, and the state departments of transportation allocate the use and how local governments get access to to transportation dollars. I was just in Virginia Beach last week before last week. And apparently the state of Virginia, the only way they fund transportation at the local level is for freeways. It's the number of lanes being built and improved. And the health department there is like, how do I get any of this money for bike lanes and active transportation opportunities and public transit? And my answer to them is the idea that this money can only be spent on lanes of freeway or roadway is a figment of the imagination of the Virginia Department of Transportation. It does not have to be that way. It can be a different way. There are states that reserve and require 10 to 20% of the transportation dollars, and it could be more, to active transportation and public transit. Which public transit leads to people walking more as they take cars. They go back and forth to transit stops. So those are two federal governments, just examples of where local, you folks can get involved in both by supporting nutrition and making sure that the state of Texas puts money into active transportation. And that might be something you do as a statewide coalition, maybe with health agencies around the state. And I'd love to comment about, the non-traditional partners. You find the environmental movement all over this, and climate change, absolutely. Another trend that we're seeing, and I think we're going to see a lot more of, is universal preschool. The data also shows that getting kids into kindergarten at a healthy weight really matters. Those pregnancy through 5 years old, those years when the palate is being set, the way the body metabolizes food and expects food is really important. And we've learned the benefits of preschool for chronic stress in families and the whole adverse childhood experiences intervention. They can do on parenting classes and really give the child a healthy start. That's a trend we're seeing. States, Utah, Oklahoma, these are not, red states. These are blue states. I mean, they are red states, not blue states. This universal preschool is another trend that we're seeing around the country, and it seems to matter for chronic disease, obesity in particular, but other chronic diseases too.
Other questions? Comments?
This is Tanisha Robinson. I'm here today representing Austin Travis County Child Care. I guess my question is, I'll preface by saying my area of focus is mostly cultural competency and focusing on diagnosing society rather than the person so much. And so I'm curious if anyone in the room or our speaker on the phone has any information about successes and partnerships in addressing social factors of stress in regards to what we're seeing right now in public safety, trusting our police department, things of that nature, where anyone finding any success in addressing how different types of isms are impacting health.
This is Marice. Let me just jump in and then pass it. There's a lot of literature out there and increasing on trauma-informed care around social stressors. And again, this is the adverse childhood experiences, the ACEs. If you Google ACEs, A-C-E, adverse childhood experiences studies, and all the trauma-informed schools, trauma-informed clinical care, trauma-informed policing, trauma-informed courts, all of this of how do we take into account the incredible stressors that families are facing and children are facing, and not what's wrong with you, but what happened to you is the question. What happened today that you are so acting out in school? Not what's wrong with you and blaming the individual, but looking at the context where that child lives and and addressing the school to prison pipeline and keep the kids in school by doing this trauma-informed discipline in school. I would like to posit that working on public policy issues is a community-level, trauma-informed way to take action. It is building resiliency at the community level. This trauma-informed schooling, policing, whatever, is building resiliency in the individual to deal with stresses, accommodate stresses in life without acting out, without alcohol, drugs, and overeating, and all the other coping mechanisms that lead to chronic diseases and ill health. That public policy is the resilience building where communities come together, they build community to look at their assets, to look at their needs. They have to organize themselves. That creates social cohesion, creates social capital. They have to learn how to speak truth to power to get the public policy change, and then they start again. What else are we going to work on? Reclaiming abandoned, blighted, neglected communities block by block. This is community-level resiliency that can go hand in hand with a trauma-informed social services. So I hope that somehow addresses your comment. I'm sure other people in the room have thoughts too.
I think we actually have another question here.
I am Ana Magay, Travis County Health and Human Services. So in regards to your question about cultural competence, I think that there's a great documentary by California Real and Natural Causes that looks at all of the many ways in which all the isms impact people's health, right? But the question for Marice was about what role do you see faith-based communities taking on as far as these policies are concerned?
Sorry, I couldn't hear you.
She was asking about what role is faith-based communities, what's their role in taking on these policies?
Oh, great question. I'll tell you, at ChangeLab Solutions, one of our biggest funders is the Robert Wood Johnson Foundation. We support their childhood obesity initiative. We're setting up a policy center. We've been working with them for years. And part of, they just re-upped their $500 million new 10-year commitment to childhood obesity. And as that is getting launched, we're doing some deep listening and learning with the faith communities so that we can make better bridges to them as community-based organizations and leaders in so many low-income communities. So let me talk a couple of different strategies. One is, just as I said, the faith community as a community leader. We are doing a lot of work with faith communities on opening up their facilities to after-school youth and recreational youth. We started out in North Carolina working with a community transformation grant there that the state health department was getting schools to open up their playgrounds for community youth. And this is really looking at rural North Carolina. The state school board said, forget it. Not going to happen. They had 25 different reasons why. Not going to happen. Into that gap walked the faith community. They said, we have playgrounds, we have gymnasiums, we have multi-purpose rooms, we have a mission of inviting the stranger into our midst and serving the needs of the traveler. That really met the spiritual mission of the churches to bring people in and serve the community. So there's been this huge effort, and there are a lot more churches in rural North Carolina than there are schools, so it's been a huge win. Churches are sponsoring community gardens. Churches are saying, okay, we've got a food bank, and that's great to meet the emergency food needs of our congregants or the communities, but what about food justice? Can we start working on food justice issues and not have it just be a charity function, but really look at the economic structures and food system structures of why people don't have access to healthy foods in their neighborhood? Churches have a moral voice, faith institutions have a moral voice that they can bring to this discussion that can cut through politics. I've also been following the work of some of the faith-based hospitals. I'll give an example in Wake Forest, North Carolina, where they were going to lay off their housekeeping staff. They had to cut budgets, not all their housekeeping staff, but a lot of them, and they're going to bring in lower-cost contract workers. The community benefits team there said, wait a second. The housekeeping staff, the long-term employees, they get what we're doing in this hospital. They are our ambassadors into the lowest income communities with the highest burden of disease. Let's use our housekeeping staff as ambassadors for prevention into the communities that are driving the cost, the high cost and overutilization of ERs and high incidence of preventable disease. These housekeeping staff are the perfect ambassadors for us. Let's equip them to be community health workers and get them to work through their faith institutions or other, and this is a Baptist hospital, so the faith conversation was very easy for them to have. And so a whole different way of thinking about hospitals, and instead of laying off staff, let's drive down our costs by doing more preventive medicine so our ER isn't being overutilized. That's the problem, not that we have housekeeping staff that are paid a livable wage. So, a number of different strategies there with faith institutions, and I think we in public health are just learning how to do effective partnerships around the country. There's, I'm sure, great success stories in many communities, but they're not well known right now.
Any other questions? I'll turn that back over to you. Let's thank Marice for her testimony.
All right, thank you, Marice. We'll free up your time now. We can end the webinar. Do you have any closing comments you'd like to make?
No, just thanks for inviting me. I hope this was in sync with what you're doing. I encourage you to use our resources however we can help. I know communities all over Texas are using them. I hear from Houston in particular all the time, and San Antonio too. And I hope Austin and Bill Sage, who's I think part of your group somehow from the University of Texas, is on our board of directors. So we have really close ties to all of you, and I hope that we can work more in the future. So thanks for inviting me, and have a great rest of your meeting. Take good care.
Thank you so much.
Bye-bye.
Sure.
Yeah,
Wait, we need the microphone because we're recording.
do you know me? I always have black eyes. Who asked the trauma-informed care coalition? Care question?
Yeah,
You did.
I'm
Oh, yeah.
one of the resources, but I'm just curious what other places are using, actually intentionally incorporating
Well,
that.
I'm glad you brought it up because I was in a meeting last week with a bunch of child abuse serving organizations led by the Austin Child Guidance Center. They have a trauma-informed care coalition. And what they have been doing is responding more in terms of counseling. So they have the kids who have been traumatized coming into their centers, but they're really wanting the community to essentially embrace change the way that she explained it. In terms of creating communities where there's a connection to kids and there's support of children and they are being raised by a community who loves them and nurtures them. And so she asked the medical school, anybody here from the medical school? Okay. Because, they want to broker some meetings with the medical community because it seems like the trauma-informed care folks are more in the institutions that are responding to the trauma versus, as Mary was pointing out, those unusual suspects who can really help us here in terms of creating those communities that support kids. So if you need to follow up with me, I can maybe connect you with some people, but that is a big question because it manifests itself in obesity and other kinds of factors. Thank you.
So this is Vanessa Saria, so anybody who wants to continue that discussion, make sure that you catch her after the meeting. We did not give Brooks any due justice time for questions, and I can feel the energy shifting, so we do have to be out of this room by 11:45, but I do want to make sure that anybody who has a question for Brooks gets to do it now. So any hands? Did anybody write down a question and wanted to?
I saw something recently on TV about classrooms that have standing desks and a little kick thing that kids can be active. It seemed to have some notable results in attention spans and activity levels too. Have you seen that or anything that you might add to that as a way of getting more activity?
Yeah, certainly. I can't speak to the research. I'm not totally up to speed on exactly what results they've seen. I'm like you've heard most of the anecdotal evidence of it reducing negative behavior or problem behavior, increasing attention. But I think very importantly, it reinforces a culture of health, a culture of being active at the school level. And we do have strong evidence that when the messaging is really being connected from like the principal level, or even if you can get superintendent level all the way down to the classroom, that's where you really have the biggest benefits, and put that as the not just inter but in like para-school environment tool, so that you're encouraging people to be active around the school. But certainly in the classroom, teachers are saying that has helped them. I can't say that it's an evidence-based practice yet, but I'd be happy to look at more of that evidence too.
Yeah, I wanted to know, Brooks, if any of y'all are looking at, or any of the professors are looking at the deep fried Fran.
Yes.
You know what I'm talking about?
I already know.
Okay, if anybody is looking at, I'm just curious, like, what the reaction has been from school districts across the state with that, and then also I know he is pushing this I think Farm Fresh Friday. So I wanted to know if you guys are looking at any evaluations with those within the TDA. You can explain since I can't talk.
First explain what deep fried, whatever.
Yeah, so what Joy's talking about is the recent lift of the ban on deep fat food fryers in schools that many of you probably heard of, which really seemed like a step backward in our nutrition state nutrition policy, and which they also threw out the door. But it's not all bad because there are USDA guidelines that are coming in. It's not a bad thing to be in line and consistent across districts, and many districts are doing more than what was already required. I think it was a big kind of political posturing move more than anything. It's very expensive for schools to put in deep fat fryers since they've already gotten rid of them. We're going to find out. We did put in money for a grant to see if there is any impact of the repeal of the Texas school nutrition policy. I'm not sure if we've heard if that's going to be funded yet, but I can't imagine it won't be, because it's a really great natural experiment. The one thing I have heard is that we have been talking with TDA as well, and they're really the people that are working there are fantastic and doing really cool stuff to encourage more local food, encourage like food trucks that have these really great local, meeting the school nutrition guidelines, like a federally funded school meal that's provided in a food taco truck outside, that like these gorgeous things that they're doing with like the Farm Fresh initiatives. But I have heard that at least one school with new construction is now putting in the deep fat fryer. So that's one place where it might come back, is in new school construction. It's really hard though to create foods that are going to meet the USDA guidelines when you're using a fat fryer. You can maybe do it once or twice a week, and pretty minimally, without, but again, TDA is in charge of auditing that, so they're policing themselves, and if they revealed it, what are the odds they're going to really hunt that down?
Any other questions? Well, Maggie, can you tell us what's next for this great group?
First off, I just want to thank everybody. This has been a long day, and we've learned a lot, and everyone's had really awesome comments and questions, so you guys all deserve a big Next steps are in November. We're calling together our panel of experts. So if you're is this still on? No. I didn't think it's a forcer.
I will turn it back on. It's just
okay.
Going through its thing.
Oh, okay.
You have a loud booming voice.
I do. Well, let's hope that.
You should be back on that.
There you go. Yep. So if you're a Health Equity Policy Council member and you have your name tag on, there should be a white ribbon on it if you are considered a data expert or a policy expert. If you have a red ribbon, you're kind of a community expert. So in November, we are convening all of those experts. We have a buffet of menu of policy options that have been discussed here. Some of them have been discussed here today. Some of them are other examples. We're going to run these policies through our policy criteria tool. And these panel of experts is going to narrow down our policy options and come up with a recommendation to bring back to the full council at our December meeting. So in December, we're going to have our panel of experts present their policy recommendations to the full council, and the full council is going to come to consensus on the one policy that we're going to pursue in 2016. Feeling very ambitious. This can happen. So those are our next steps. I'm going to turn it over to Christy for closing comments, but just one last housekeeping thing is your evaluation form. Make sure that you turn it into Doris right there in the pretty blue dress, and she's waving her hand, and she'll give you a prize for turning in your evaluation. All right, thank you.
See, we're incentivizing good behavior. All right. A date for the November training? It is
November 10th.
November the 10th is the date for the policy menu. So thank you so much for being here today. I know that, Vince, do you have another question or comment?
When will the audio and the slides be available?
Give us 1 week.
1 week. So thank you so much for being here today. I am really pleased with the way the day came together the morning came together in terms of content, and I appreciate Brooks, you're here, and other speakers who lent their time and expertise to us. Thank you so much. I know I learned more than I thought I would learn, and I've got lots of great ideas generating. I hope you are too, generating those ideas, making notes, and that you're bringing those ideas and energy back with you when we see you in November, where we're really going to roll up our sleeves, look at that menu of policies, and start going down that path of making some choices about what we want to pursue for our community. So thank you for your interest and time, and we look forward to seeing you in November.